All right. Want to be respectful of everyone's time, so we're going to get underway. We may have a few folks joining us as we get going. Welcome to TAO's Smart and Connected session. This one's on data management, ownership, and identity. My name is Skip Newberry. I'm president and CEO of TAO. We host these roughly quarterly, and we used to do these in person. Then during the pandemic, we shifted to virtual, and lo and behold, we found that we had the opportunity for folks from all over the state to participate more easily through the virtual formats. We decided to keep going with that as we now enter whatever phase we're in now. We're excited about today's speakers. We have both Carol, who's someone I've known for a little while now, who has a long-standing background in everything from fintech to banking and finance, and also Juliana, both of whom will share a little bit more about their respective backgrounds. Juliana's with the Central City Concern, and today we'll be hearing about, in the context of how can we most help those who are vulnerable in our society. We'll be using that as a case study to delve into larger conversations around data ownership and management. So pretty excited about today's conversation and hearing from both Carol and Juliana. We also have Ashley on our team at TAO, who is helping run event support today and also oversees a lot of our sponsorships and event-related programming. We're glad she's able to join us today as well. In terms of some basic sort of housekeeping, we've got, as you know, an opportunity to hear from the speakers first and foremost. So we'll ask you all to please remain on mute unless you've been called upon to speak. And we'll shift to a more interactive format once the speakers have had a chance to share a little background. We'll be helping to moderate Q&A during the latter part of today's session. And of course, feel free to share thoughts and questions while the presentations are underway. You can do so using the chat feature. And with that, I want to cede the floor to Carol, and we can take it away from here.
Thank you, Skip. We're actually going to do it the other way around.
Oh,
We're going
Juliana, who's going to start first then?
Okay, thanks.
All right. Well, I will take the lead then. Hello, everybody. I'm going to share my screen, and hopefully everybody will be able to see the presentation. Please let me know, one of you with a Skip, can you see that?
I can. Looks great.
Okay, great. Wonderful. Well, hey, hello, everybody. I won't be able to see the chat while I'm presenting. So if there's a question that comes up, Skip, and there's a opportunity to interrupt me or not, you can just rudely interrupt me or not. I'm pretty okay with that. Or we can do some questions at the end. But I am Juliana Lukasic, and I'm the Senior Director of Public Affairs for Central City Concern. And I'm not going to assume that everybody here knows about Central City Concern, or maybe you've heard of us and you know a little bit, but I'll just run through sort of a few slides here that talk about what Central City Concern does and give you some context around homelessness and what's happening in our community right now. First, some history. Central City Concern started in 1979, and we started mainly for men who were intoxicated and sleeping outside on the streets. In 1982, we opened Hooper Detox, and Hooper Detox is open today. It's a detoxification clinic. It's often the front door to our services. Folks voluntarily come and stay with Hooper for a little bit of time for them to get stabilized. Back in 1982, that was a safe place for people to be. In 1984, we opened the Estate, which was a drug and alcohol-free housing community. And it was mainly for folks leaving Hooper, so they had a safe place to be. In 1987, we introduced acupuncture with success. And in 1992, we added employment services. And, knowing that we could help people who were in recovery be able to have full-time employment. In 1999, we started our social enterprises, and those are opportunities for folks to engage in the community. The most visible one we have is called Clean Start. I'll talk about that a little bit later. We then opened in 2001 our Old Town Clinic, which was when we brought healthcare into our portfolio. And that facility has, had primary care and behavioral health care. In 2005, we opened the Old Town Recovery Center in the same building, which brought all of the healthcare services under one roof. And ultimately culminating in 2019, at which time we opened our Blackburn Center, which truly is a one-stop facility for us. Housing, healthcare, and employment services are all under one roof. That building is on 122nd and Burnside. So let's talk about some of the drivers of homelessness. There are, structural factors. There are individual factors that can lead to homelessness. The structural factors can include absence of housing. We hear about that a lot in the news. Absence of meaningful wage employment, absence of mental health and recovery services, racism and discrimination. The BIPOC community is represented in homelessness more than they should be, considering the size of their population and the interaction with the criminal justice system. Individual factors can include adverse childhood experiences, serious mental illness, substance use disorder, personal history of violence, and disturbingly, just added to this list in 2018 was simply being over the age of 50 is now a determinant, a potential determinant of homelessness. All of a sudden, my screen's not going to the next screen. Stand by. There we go. So let's talk about Central City Concern. We have, this is 2021. We're about to update this with 2022 information, but our annual report is not fully printed yet, so I don't have quite up-to-date information. But in 2021, we served almost 4,000, we housed almost 4,000 residents we're up to 2,400 homes across 31 properties. And that is recovery housing, transitional housing, permanent supportive housing, family housing, low barrier housing, housing for people exiting incarceration. We provided healthcare for almost 10,000 people in our community, in our now up to 13 federally qualified health center sites. And we did that with integrated primary care and behavioral health care, community mental health services, subacute detoxification, residential and outpatient recovery services, acupuncture, and pharmacy. And finally, employment. We helped almost 1,400 or 1,300 job seekers with our one-on-one supportive employment servicing, including a lot of peer counseling and mentorship, volunteer opportunities that build confidence and work skills, and again, mentorship through transitional jobs and social enterprises. I'm going to back up a moment. One of the things that is true about homelessness is something that I come across every day, and that is a stigma attached to people who are in recovery. And the stigma frequently says that people cannot recover from being addicted, and that especially with the acute drugs that we see today, that it's even more difficult to recover. And I can tell you from personal experience that I meet people almost on a daily basis who have recovered. You can recover. The services need to be there for people to be able to succeed, but everyone can recover from being addicted or being homeless. And the current acuity is a real thing, and it's changing how we operate as a provider, but people still succeed. It takes longer, and they need more support. But on a daily basis, I get to meet people. And so I'm just going to run through a couple stories. I'll just pick two of them and gloss over the third one so that I can stay, keep going, keep a good amount of time going here. But we'll start with Brandy. So Brandy's story is very similar to a lot of stories out there. She had an unspeakable and violent tragedy in her family. She had to leave her home state of Alaska and come to Oregon. And she unfortunately began using drugs. And she quickly went downhill, had very severe health conditions. And so we came to us first through a recuperative care program. It's an incredible program where people who are coming out of hospital that would normally be released from hospital into homelessness have a place to go in our recuperative care program. And she got stabilized there, and then she got primary care at Old Town Clinic. She took advantage of what we call MAT, medication supported recovery, medically assisted treatment. She went to our Richard Harris building, which is a supportive housing environment, where she received peer counseling and acupuncture. And today, right now, she's a case manager for the recuperative care program. And she is she is supporting others as they journey through their recovery. She's really wonderful at her work. And this is Ralph, although he likes to be known as Coco. And Coco started using drugs when he was very, very young. He entered Hooper voluntarily. That's our detox program. And he received support with mentoring and peer counseling. He joined Madrona. He lived in Madrona Studios, one of our supportive housing projects, got medical support from Old Town Clinic. And significantly, he began to do a program called Community Volunteer Corps. Community Volunteer Corps is a place where folks that have been in our services can go and they give back to the community. They spend 80 hours and they give back to the community through the Parks and Rec, through the Sunshine Division. And once they graduate, they get assigned an employment specialist. And currently and recently, Coco just joined the recuperative care program as the manager. So it's a really beautiful story of recovery. And he credits Central City Concern with helping him reconnect with his son, which was incredibly important to him. So that's another story of sort of how one might journey through Central City Concern services. Anthony has an incredible story as well, but I'm going to go ahead and move through that so that we can stay on time. It's confusing. There's a lot of different kinds of housing, and you hear a lot of different kind of housing talked about in the community. Central City Concern has recovery housing, which is designed to support participants in their chemical dependency and treatment and early recovery efforts. We have low barrier housing, meeting people where they're at with immediate housing. Transitional housing, where people stay from 6 months to 2 years as they get stable. And then permanent housing, and it's permanent affordable housing for people who need a little extra added layer of assistance. We also have family services or family housing. It's supportive housing for families with young children, provides on-site services like recovery support, parenting, and financial skills classes. We also have Letty Owens Center, which is an incredibly unique program a lot of folks don't know about. It is residential treatment for pregnant and new mothers struggling with substance use. So women who are in recovery can come to Letty Owens and have their babies there. And it's an opportunity for those mothers to stay connected with their newborns, and often are able to keep their other children with them as well. So it's a really important program. There's only one other program in the entire state that is like this. Much more services like this are needed. And then our health services, we have integrated care centers like Blackbird Center, Old Town Campus, both have pharmacy on site. We have residential care like Hooper Detox and the Recuperative Care Program. Letty Owens are in that category. We have culturally specific services, which I'll just brush on later in the presentation, and some other services like benefits counseling and outreach and enrollment. Who are we serving? A majority of the clients have experienced homelessness. Many have an active substance use disorder, and more than half have a monthly household income of less than $100. I mentioned the community. These are social enterprises. I mentioned the Community Volunteer Corps. We also have Employment Access Center, which specializes in one-on-one services to help the homeless clients compete successfully for living wage jobs. We have Clean Start, which is the program. You've got a picture of a Clean Start worker right here. They're the folks you see out on the streets every day of the week, Monday through Friday, cleaning up. They're pushing barrels, and frequently these folks have lived experience. In fact, they almost always do, and how are in recovery themselves. And this is often their first job, and it's a bridge to their hopefully lifetime job. And then I mentioned our culturally specific programs. Those are important programs based with peers who look like you, and the success and importance of culturally specific programs cannot be measured. It is very, very effective way to reach this community. We have Flip the Script, which is an integrated housing, employment, and peer support services for recently incarcerated African-American and Black community. We have the Amani Center, which is an outpatient mental health and addictions treatment services by and for African-American or Black community. We have Puentes, which is our outpatient mental health and addiction treatment for the Latinx community. And Caribou, which with great excitement, I can say, is grand opening ceremony is tomorrow. And that is a program that helps, it's a stabilization and treatment program for Black men coming from incarceration. So it's a very important program. We're opening it tomorrow. There's a big event out on Powell Boulevard, and we're very excited about that program. We have real estate development as well. We've recently opened our Starlight in 2022, which is 100 units of housing. We have Cedar Commons that opened in June of 21. River Haven, which is a turnkey project. I don't know if you know what turnkey projects are, but we basically took a underutilized hotel and transitioned it to housing, and it was a very effective way to get housing online very quickly. This is sort of a map of where we're at. We're in downtown Portland, we're out in East County, and we have a presence in Clackamas County as well. So I'm going to talk about technology finally. We're all here to talk about the technology aspects of what we do. And so I'm going to jump into that. Skip, before I do, is there any questions generally about CCC that appeared in the chat?
I didn't see any, but this is a good chance if folks spur of the moment want to ask any.
Yeah. Does anybody have any questions about us?
And I was going to say, while technology is important, it's usually not well adapted to the problem at hand unless we also understand kind of the human aspect. And I think all that context you just provided is definitely helpful for folks to understand just the depth and breadth of the services provided by Central City Concern. Any questions that folks have? All right.
All right.
Juliana,
okay,
get into the tech part of it.
Yeah, let me move into that. So sort of, one of the first things was how does Central City Concern use technology? And I'll just run through some of the technology that we work with. We have solutions for most of our business operations. We are very excited to announce that we're doing an Ocean Epic employee health record system implementation. It's in progress. And it is actually going to be a real game changer for CCC. It's going to improve client safety, ability to coordinate care, and it's going to improve our connection with other health providers. It's a really big deal to us. We utilize care management at Cedar Gate, a Cedar Gate population health data product, and getting population health data really helps us determine successive outcomes. We utilize Pioneer RX system for our pharmacy work. We use MIP financial system in HR. We use Icertis for our contract manager, Yardi for property management, and Salesforce for fundraising and social enterprises. I should note that as the public affairs director, I am in charge of all things related to communications, policy work, and fundraising. So we actually use Salesforce a lot in the work I do. We just completed implementation of the Apricot 360 to improve our client experience in our supportive housing and employment services, which allows us to track services to identify positive outcomes, to learn what's best for our clients. We use data a lot. We would love to be using it more. It's a big deal to us. It's how you track success and outcomes, and how you hold yourself accountable to those outcomes. This also, Apricot also helps us in our reporting to funders and supporters. And how do our clients utilize technology? Smartphones. Number one way that we connect with our clients is by use of cell phones. We set appointments and do confirmations. They complete job applications. You know, it's a really important device for us to utilize with clients. We also shifted really fast to telehealth during COVID. There's a ton of potential with telehealth, especially as it relates to group sessions, which is really important. We set up telebooths, which are freestanding and soundproof web-enabled booths equipped with laptops, and they offer a clean, calm, and private space for residents can virtually meet with their providers. We deployed Chromebooks. We purchased them with funds provided by, I don't know if we have anybody from Intel here, but a little call out to Intel. Intel's Pandemic Response Technology Initiative, a program designed to combat the effects of pandemic through increased access to technology. An excellent example of how tech can work with a provider like Central City Concern to utilize technology to help our homeless community. We're working with Microsoft Teams, setting up a unique video setup for our detox center to allow for closed captioning for our hard of hearing clients. And some of our clients use Easy Access, which is a patient portal, to communicate with their CCC care teams. So there's some of the ways that we're seeing our clients utilizing technology. And then I'm going to move to how does our community use or not use technology? And one of the big issues is access to affordable Wi-Fi. If we could solve that, this is a very short list. The ways that accessible Wi-Fi could improve the life of our homeless community it's just massive. But access to virtual meetings, doctor's appointments, group counseling, family visits. We had a cold weather. We are not out of it yet. And being able to just simply alert our homeless community that there are warming shelters can actually save lives. It's a really critical element to technology, and it's not working right now. It's not good enough. Another issue is that CBOs, community-based service providers, do not have access to a centralized database. If we had one, we would be able to get daily updates from our homeless clients. We would be able to connect with other CBOs, community-based organizations, and we would be able to share information and data to improve outcomes, which is really, really important. And one of the things that we're excited about is that we're going to have the ability to integrate Epic with Apricot, for instance, and, integrated systems leads to connections with other CBOs in Portland regionally and nationally. It includes major improvements to our electronic health records and how we utilize those, and future integration with housing, healthcare, and employment systems. That's an internal improvement that we are expecting to come soon. So that's sort of how we use technology, how the community uses technology, how our clients uses technology. I could go on and on about this topic, but I won't. Instead, I'll end the presentation and thank you all for for allowing me some time to talk about this, the organization and the homeless community. If you want to reach us, you can do so through centralcityconcern.org. Again, I will pause before we hear from Carol, which I'm excited to hear from Carol myself, and see if anybody has any questions. And I'm going to stop sharing my screen.
All right, looks like we've got Jordan.
Yeah,
Go for it.
sure. You mentioned using a centralized database to better coordinate care with other providers. I'm curious if, considering that solution, you have a concern for centralized data versus a decentralized data, basically like avoiding the security concerns or the privacy concerns of having a centralized database that is shared by many providers. And our electronic health records a good model for that? Is that mostly centralized databases? Do you just have thoughts on that kind of question?
Yes, great question. That is one of our, that's why we haven't yet, that's what we intend to get out of Epic. So Epic is a centralized data system that many of the largest healthcare providers utilize. So we will be able to have a more centralized electronic health records system, which is really important in the homeless community. You know, if somebody comes to us and they've say, you know, lost their phone or they don't have their records available, being able to go to the system and share that information is absolutely critical for their care. And it is a massive security problem. And that is one of the reasons that's a big barrier for us, because we cannot, there are a lot of as federally qualified health centers, we are under HIPAA requirements very strictly. We not only is that important from a legal perspective, it's critical for clients, you know, just for client safety and client privacy. And so that is a really big problem. And that's one that we're addressing with this implementation. And we're able to do this implementation through a grant in part from Providence. And so once again, our community has stepped up to support us in this critical step towards coordinating care between providers. It's really important, and it's a challenge, and it's not something, you know, when you start thinking about housing and the information that's coming from our housing folks and supportive housing especially, it's very complicated, and it gets complicated very quickly. I don't know if I answered your question or if you have a follow-up. I hope that answered it.
Yeah, it does. I think part of my question is about, I guess, the security concern. Do you consider alternatives to a centralized database, like somehow networking more decentralized way to coordinate data?
You know, I think that that would be a better question for our data, you know, for our tech team. I'm sure that they are considering all of those. You know, we you know, cybersecurity is a big issue for us. I hate to bring up bad news, but about a year ago, the city was had a hack that actually somebody stole almost $1 million of funds from basically Central City Concerns through a data breach. And they didn't take it from us, they took it from the city, but the city had to make us whole because it was a contractual situation, and that was a cybersecurity issue right there. So we've seen it. We are really deeply concerned about that, especially as a nonprofit who doesn't have deep pockets to be able to address security issues in the way perhaps a larger organization could. So it is of deep concern to us. Anything related to security and safety around our data and our client information, et cetera, it's a real threat.
Cool, thank you.
Thanks, Jordan. All right, Carol.
Okay, well, thanks. And hello, everybody. Nice to meet you. I'm Carol Coy Benson, and I'm here to talk to you about the Oregon Digital Safety Net, which is a concept, not a live service as yet. And here I will share my screen so that we can start talking about it. me try to make this happen. Are people seeing this now?
Yes.
Yep.
Okay, okay, very good. Just to give you a little quick background on myself, as Skip said, I do come out of the financial services world, for which I apologize, but I'm actually out of the financial side, out of the technology side of that, in the sense that I've spent most of my career working on new product introductions that are technology enabled. And I have an interest in where technology can be used to make things happen in scale. And I'm particularly interested in where modern technologies can be used to make things happen in scale. And when I use the word modern, I'm interested in things that can be done in very lightweight ways that are very secure and very consumer friendly. And so when I retired from active working life and looked at how I could be involved in doing some things to benefit all Oregonians, worked with some colleagues, and we came up with this concept, and we've been sort of socializing it for the last year and working with the Technology Association of Oregon, who've been very helpful to us. And so we've come up with this idea, and let me tell you about what we think the problem is that we've identified and the solution we're proposing, and then we'll tell you sort of where we stand with it. So what is the digital safety net, or our shorthand of it is ORDSN? We see it as a nonprofit initiative to improve digital communications for people with disrupted lives. So in Oregon, poverty combines with a wide range of social and medical crises to disrupt the lives of many Oregonians. Often, this disruption is long-term. Now, we all understand that digital communications, obviously having access to mobile phones and the internet, but it's broader than that, is critical to participating in the modern economy. But there's many initiatives that are already in place that are aimed at helping people to get phones and get internet access. Now, admittedly, those aren't totally solved problems. Juliana just mentioned the fact that the internet access is still not perfectly solved, but ORDSN is not addressing that problem. We're addressing a different problem. Our informal research shows that most people in these groups that are suffering from disrupted lives have mobile phones, but they rarely have the same phone for long periods of time, as these phones are stolen or lost, or perhaps they were just short-term prepaid phones or burner phones to begin with. But they don't have an ongoing economic relationship with a phone carrier. As a result, they can't roll over their phone number to a new phone when the old phone is lost or stolen or goes away. As a result, they don't keep their same phone number. They lose their old phone number. And they really become invisible as a result of it. Employers, landlords, doctors, courts, benefits organizations, friends and relatives often can't reliably reach them. And to make it worse, these same people often don't have a stable physical address. So this is the problem that we are focusing on, this invisibility. And it's interesting that TAO called this session, focused on data and identity, because we haven't been talking about ORDSN as an identity solution, but it really is a form of identity, because if you can't be reached, you really, have sort of lost an identity. So it's a problem both for the person who can't be reached and for the institution and the people who need to reach them. So the solution, and I'll tell you about it in more detail in a moment, but it's basically a package of what we're calling evergreen communication capabilities. And these communication capabilities are going to be long-lasting capabilities, long-lasting phone numbers and other services that are going to remain with people and work with them with any phone or device that they are using. They won't be tied to a specific phone or device. And excuse me, I've got a typo on that last line. The evergreen services do not require a commercial relationship between the user and a provider. These evergreen communication capabilities will be delivered through service agencies. And that's a very loosely used term, but we would consider Central City Concern to be a service agency, such, that provides services to these populations today. And there are hundreds of such entities, public and private, large and small, in Oregon today. Their workers are often highly trained professionals, but their work is often dragged down by the need to cater to the communications problems that their clientele have. So just as an example of how these disrupted communications impact people, think of a high school dropout. As an example, Tom, a high school dropout who is homeless and in recovery from substance abuse. He's sporadically worked in construction and restaurant jobs, and it frequently applies to jobs and is waiting for word from employers who are going to offer attractive jobs with good hourly wages. But his phone has been stolen and he's got a new burner phone, but now he needs to walk back to each place there he's left a job application in order to give them a new phone number. Another example, Maria, recently released from prison after an 18-month sentence. Her 2 children have been in foster care. She applied through a court procedure to obtain custody. She's waiting for a letter from court granting her custody, but the address she gave the court and her phone number are no longer valid for various reasons. So how is she going to get that letter? Giving her the custody, so that she can connect with her kids. A third example, a 50-year-old home health care worker, her doctors, she needs to get information from her doctors, but her prepaid phone number is no longer good. There's just, in the year we've been talking to people about this, we've heard example after example after example. Many of them are homeless people, but not all of them are. There's many, many use cases. There's also use cases and examples from the institutional side. And I'm not going to talk through all of these, but they're, a social services agency that needs to reach their clients, a community health organization that needs to reach their patients, the contractor who's trying to find their employees, the housing agency that's trying to find the people on their housing list. There's many, many examples of these institutions that are trying to reach people. So there's, beneficiaries on both sides if we can solve this problem of disrupted communication. So what are we talking about? What are these evergreen services going to be? Well, what we're proposing with the Oregon Digital Safety Net is to repackage existing digital assets, not to build something from scratch. for use by individuals and target populations. The 3 blocks on the left are what we consider our core services, which we would include in what we want to do as a pilot program. An evergreen mobile phone number, this would be an IP telephony number. Think of Google Voice is the best known example of this. So a long-lasting phone number that would ring on whatever phone the person is using. So the person would be given this evergreen phone number, and they would hand it out to any institution that they want to be able to have reach them over time. And it could be assigned to any phone they are using. And if that phone is lost or stolen, they could assign that number to the next phone they're using. They'd also have a long-lasting email address, and they would have a digital vault that they could use to store messages and documents. Those 3 things would be included as a bundle. Later, we envision an evergreen post office box number. If an individual opted in to this service, first-class mail that was delivered to that post office box number would be opened and scanned, and an image of that letter would be put into their digital vault, and the original letter would be destroyed. And a long-lasting digital bank account, which could be used for the receipt of government payments and other transactions, and which could not be closed for inactivity. So those are the 5 main components of all of which would be not built for Oregon Digital Safety Net, but are existing digital assets. This is another view of the functional architecture of ORDSN. That top row in green are, again, those third-party services. ORDSN would build the reddish pink stuff on the bottom, which is a very, very thin enrollment platform, which the service agencies would use to enroll individuals. That could be just a simple web access by a small service agency, or it could be a more sophisticated technical interface by a large organization such as Central City Concern. There would be a very, very small database with no personal information kept, just in order to be able to enroll people. This would be very minimal operation on ORDSN level. Working with some of TAO's members, we've reviewed this functional architecture and have had a lot of head nodding that they think this is a viable architecture for this service to operate in scale. The vision is that it would happen Oregon-wide after a successful pilot. I'm going to skip over this because we've already talked about the service agencies. This is just a summary of the stakeholders and the benefits. We have the target individual. The goal is they would no longer be invisible. They'd be able to be reached. We'd have beneficiaries, the service agencies would have a reduced time and resource costs and being able to deal with their clients. You'd have other beneficiaries, hospitals and other institutions that are able to reach their individuals that they're trying to reach. And we'd have a variety of other community beneficiaries, technology and service providers. And we have in mind a variety of entities that we believe would be willing to fund the operations of this, both philanthropic funders and government funders over time. Where we stand today, we have presented this to many community groups, technology providers, government groups, and service agencies, and have received positive feedback. We want to do a pilot. We've received some funds so far, but not enough to conduct a pilot. So we're in discussions with other possible funders. If anybody wants to discuss this further with me, I would be delighted to do so. So that concludes my remarks. I'm going to stop the sharing, and I think both Juliana and I are more than willing to entertain further questions.
Thanks, Carol. All right, floor is open. Questions? And
I do welcome skeptical questions as well as informational. I know I was talking very fast, but I wanted to make sure there was time to cover all the basics.
Yeah, and feel free to, you know, to take yourself back on video. And okay, we got a couple questions here. Might as well make this a little bit of a group discussion. We've got, I think I saw Kevin Martin first.
Yeah, thanks, Carol, and thanks, Jillian, for the presentation. This is really great information. I'm Kevin Martin. I'm with the City of Portland. I lead our Smart Cities program, Smart City PDX. Carol, I'm just curious, can you name the major technology partner at this point, or is that not information that you can share?
I don't see any reason why not. Google has given us some money to start.
Okay. And I was just curious if you could talk a little bit more about sort of the logistics of the digital vault, maybe a little more information on how that's going to work.
Sure. There's two stages of that scene at the onset with the sort of what we think of as a stage one pilot, especially, and by the way, we have thought that for a very first stage pilot, it would be the most likely, although it is not necessary, that would be with Google. In other words, the fact that we have funding from Google does not mean it has to be Google with Google Voice and email, but it might be easiest to do that. And you would, if you had Google Voice and Google Email, the digital vault just sort of comes with that. And that is a less secure digital vault, right? That is just sort of what comes with, right? But the notion is that at the same time that we would implement mail scanning and bank account feature, we would move to a more secure version of a digital vault where a consumer would have more control over their data, which is the kind of thing. I'm a great admirer of what they do in India, for example, where the consumers actually have control over what is put in their digital vault. And I could see that is the direction we would go in. I believe that's what the city is looking at as well, right?
Correct, yeah. Thank you.
Yeah, just put a finer point to the money came specifically from Google's foundation, not from like a marketing budget in one of the business units. And the idea there was that, you know, this is an interesting sort of problem faced by many communities up and down the West Coast and beyond, in which Google has offices and employees. And so from a sort of community engagement priority standpoint, that was one of the sort of drivers of this that caught their attention.
And sorry to jump in, are they doing this in any other cities, states, or would this be?
So that was another thing that was compelling, is that at least when we started the conversations, to our knowledge, this was a pretty novel project. And whether that's still true today, who knows? But yeah, at least when we started the conversations, that was one thing that was confirmed, at least by some of the folks we talked to, that they hadn't seen something like this underway yet.
And they were definitely interested in the potential for, you know, national, global, you know, but it didn't mean that their money was tied to anything at all. including our use of Google products, so it's not that. And I do, I think, anyhow, I'd be happy to talk more about that going forward, but.
All right, next we have Eric and then Jordan again.
Hi, Eric Gordon. This all sounds really cool and really exciting that we're able to help people who need it, using technology, but sometimes we forget about other parts. And so I'm curious if there's been consideration, I know using groups like Central City Concern to get people set up, but, has there been consideration around the training? And I call it change management, but the helping people understand how this works, how to set it up, how to engage with it, and also especially knowing that a little bit that there's some not issues but concerns out there, the privacy concerns, like how is that going to be addressed for people who are signing up for this? Is that all part of the pilot, is understanding how to apply and train and teach, or has that been considered?
Well, let me answer that in a couple of ways. One is ORDSN is an exceptionally narrow tool. Okay, all it is from the end user's point of view on the phone, for example, it's just another phone number. Okay, it's nothing else. And so we see it as a very narrow tool that could be broadly used. So for example, there are many, so that in and of itself, that piece of it doesn't need any end user training, right? The fact that there is a big need for digital literacy training, I don't disagree with at all, but that's not the problem that ORDSN is trying to tackle. Okay, so that's not what we're trying to tackle. Later on, for example, when we hit that mail scanning thing, it's going to get much more complicated. Okay, that's not as simple in implementation, but this phone number thing is actually very narrow. If it gets more complicated than we think, then yes, obviously we'd have to look at the whole solution. But the idea is to try to keep it very, very light, very, very narrow, so that we can be as broad as possible, as low cost as possible. I believe that large service agencies such as Central City Concern will want to take this skinny little tool and fit it into larger things they're doing.
Which is a perfect segue to what I was going to comment on as an answer to that question. From a population question, will the population be interested in utilizing something like this, and how would you engage them and train them? Trust is a massive problem in the homeless community. They have lost trust with a lot of institutions. Having an organization like Central City Concern or other organizations that are their healthcare providers or their peer mentors is a really big step. That's having that information come from somebody that they have learned to trust is a really important step. So you might have it be from an outreach worker who's established a relationship, from a primary care provider or a care team person or a peer counselor. So those, that's the audience that would have the biggest success in getting folks to engage in this, which could be, considered a little bit, outside of their comfort level if and needs that trust. The other side of it is, and Central City Concern is unique in some ways in this, is that we're big enough that we have enough programs in place that as things got more complicated, we would be able to sort of support that effort. We have, training as part of a component of our organization already, so we could develop a training platform. We also have a program called BEST, which actually a lot of folks don't know about, where we help people get enrolled in the Oregon Health Plan. We help people collect do the paperwork required to get their disability reinstated or to get their driver's license. So we already have professionals that are working in that level. We also act as the bank for folks who need that additional support and opt into that. We act as their financial partner, and that exists right now. So kind of back to what Carol was talking about and why Central City Concern is so interested in this opportunity is that we have existing programs that could be tuned to work for what she's talking about. And, you know, I love a pilot project, because once you get the pilot project with a larger organization like CCC, then for some of the service providers who may not have that training ability or the financial planning side of it, you definitely could set up some training for those organizations as well.
You know, if I can add one other thing, and Eric, I mean, I realize maybe I was a little bit too not thoughtful enough about this, because there is a serious question that the pilot is going to need to test, which is, at the end of the day, are people going to be happy with this concept of having a second phone number? Okay, we don't do that today. Most of us don't do that. And the notion of, here, I'm going to have a second phone number and I'm going to give out my second phone number, not the first phone number, is a step outside of normal.
Yeah.
And
I mean, I've been doing it for years.
Yeah, I know some people have, especially in the technology community, but it's,
I know it's a hard concept for people sometimes to figure out, and that's
exactly.
why that helping, and it sounds like, Juliana, what you have in place helps people understand and trust, and using this as a tool for Central City Concern makes a lot of sense. Sometimes I hear about these things, and I was like, it's great. And for me, that's great. And I'd sign up if I were in their place, but I'm not, and I have different thoughts. They have different thoughts and trusts, and so it's always good to think about that. It sounds like you have thought at least a little bit through Central City Concern on how that will be implemented in a way that people are going to engage and really get excited for it and understand it and be supported in it. I think that's really important, and it seems like using Central City Concern in that way, that's a great relationship. So.
And test, and if that's the purpose of a pilot, right? And test it, and if it doesn't work, then it's not worth it. Right, exactly. And Central City would be a great, yeah.
Thank you.
All right, Jordan, I think, was next.
Jordan, you're on mute.
Thank you. Carol, you mentioned the solution using Google services would be a less secure solution, and you would intend to move to something more secure. I'm wondering if you could elaborate on what you mean by that. In what way is Google services less secure, and building on that?
I'm going to get in trouble if I try to elaborate into too much detail right now. But no, I'm not going to try to do that. But I think that what we'd like to do in the pilot that we envision, the primary purpose of the pilot is to address the very issue that I was just talking about, which is the acceptability to the consumer of this second phone number. That's a real sort of almost consumer usability issue. Okay. There's a second stage of the pilot where we would be hopefully testing out the mail scanning issue, the product where we've sketched that out in some detail, the bank account services, and what Kevin was just asking me about about the digital vault idea with real consumer control over the data in a sort of more advanced state. And those three things together require a little bit more on the architecture side than the first pilot would. And I'm just going to leave it at that. Okay.
Gotcha.
All of that, we haven't done the detailed architecture on, because we may not get to that, right? You know, we've got to get through the first pilot to get to that.
Cool. Thank you.
All right, next I think we had Bridget and then Wilf.
Well, thank you so much, Carol. I'm excited about everything you're saying. You keep mentioning a second number, but it sounds to me like you're offering individuals for the first time in their lives, their own personal number, the personal number that will be theirs into perpetuity, that's not granted to them by AT&T or Verizon or some other service provider. And so that model, you know, this idea of an evergreen identity, an evergreen phone number, an evergreen email address, you know, an evergreen digital vault sounds like a personally controlled cloud that would give us an opportunity to manage personally our digital lives in ways that make sense to all of us, especially as Juliana just said, just being over 50 puts us at risk of disappearing or becoming invisible at some point in our lives. And so I really commend doing this so well right away for those that already have disrupted lives. But I see the potential for exactly what you're building for all of us. All of us have an opportunity eventually to be in a place where we'll be able to own and manage our digital footprints. And I think that's an incredibly important service. And I commend the team for making this, you know, moving towards a reality already for those that need it most. Thank you so much.
Well, thank you. I have to confess, one of my little fantasies is that every graduating high school student should be given an evergreen, you know, portfolio.
Absolutely. Who does not want this? Our
Yeah,
own personal,
exactly.
a personal
Thank you,
number
though.
for perpetuity makes perfect sense.
Yeah, thank you.
Wilf.
Thanks,
I
Kip.
think
I was originally going to ask Juliana how this would be used, but she's already answered that question. So I'm going to take the slot to take a bit of a shot at Jordan's question, because Jordan is working with the Code for PDX group that we've set up, which is trying to address the second phase of what Carol has talked about here as a more secure and secure in a number of ways that I think is important. So Google Drive is a server-based storage system, and while Google does a good job of securing that, there's both a perception problem, I think, that Juliana referred to, that it's a large organization that would be holding that information, and secondly, it doesn't give the owner the opportunity to easily move that information between services. It's hard to move data, between those services. It's not made as easy as it should be. So the system that we're working on with the Code for PDX group is called PASS, Platform or Personal Access System for Services, and it's supposed to allow us to build a data vault that you can carry around with. You could store it on Google Drive. You could put it in your pocket on a thumb drive. But it would allow you to carry that data with you and move it between services, and particularly would allow you to make a copy of key documents and give it to a trusted individual like a sister or a brother who after a bad bout of homelessness is still able to provide you with those documents. So we're exploring that. It's not at the stage at which we would be able to bring it up in the first phase, but I think, thanks to people like Jordan and others on the Code for PDX team, we're exploring to see how we could do that and do it in a way that both has the fact of security and the perception of security because of the agency of having that data be available to you individually and not tied to a service like Google Docs.
All right, looks like Stan has a question next.
Well, basically, this is a thank you. I love the presentation, starting with the user requirements and persona descriptions, because I do think that allows things to be tested, which is very helpful. And then I agree with Bridget that this is really, a key public infrastructure capability that we all need. And it's not just for the homeless. My father had a heart attack and he went in the ambulance to Providence, but his main service was Kaiser. And, between the heart surgeons and the primary care and the other elective cares for sleep apnea or other, diabetes kinds of things, the, Epic systems didn't really help that much. So I really think you're onto something really fundamentally important. And thank you for designing such a careful test. And then I do think besides phones, which there's a really good reference for a lot of the things you're advocating in the
I saw your.
public safety net
Okay.
that was done initially, I think, in California, but it's being applied in other states. But it's a very helpful way to address privacy and security incrementally, and really advocates an agile approach like you've been doing based on personal test scenarios. So I think it is useful to help this conversation go forward.
Okay.
So those are my comments. I think we need to support things like this. And this is the biggest, infrastructure investment in our lifetime that's happening. And this is every bit as important as every parking garage and bridge and road for, any caregiver, not just the homeless. I mean, but homeless is, I think that's the mayor's #1 topic. So you're on the priority scenarios too. Anyway, thank you. It's the short message. And I just wanted to explain a little bit what I put in the chat so it wouldn't be taken out of context.
Okay, thank you. No, I'll look up that project. I didn't know about it. Just one last thing that I would mention. I can't tell you how many people that I've talked to personally about this project have told me about a personal story they've had of somebody they know. And Juliana, I'm sure you have this times 100, a personal story of somebody they know who is either homeless or has a mental health crisis or a drug crisis of some sort. And they usually will tell me of a story of somebody who has a backpack with 15 phones in the backpack, none of them which work, and that they can't get a hold of this person in their life, because none of the phones work, and that it is a personal problem for them that they're not able to reach this person in their life. And so it does seem to be, and interestingly, I haven't yet, I don't mean to try to claim any great credit for this, but I have not yet stumbled across any other solutions out there that are aimed at this particular problem. There's plenty of solutions that are trying to give people phones, but that just adds to the number of phones in the backpack. So hopefully, anyhow, we're looking for funding for this. So if anybody has any good ideas, send them my way. Thank you for all your comments. Skip, over to you.
All right. Thank you, Carol, and thank you, Juliana, and thank you everyone who took some time out of your busy days. I'm really excited about this project. Carol's been thinking about it for some time, and it's exciting to get some initial traction. But as she said, we still have some ways to go. and validation is great on one level, and now we need to actually develop some resources to move a prototype forward. So if folks want to get involved in any way, of course, feel free to reach out. We're glad to get folks who have the interest in bandwidth involved. And with that concludes our discussion today for Smart and Connected. We're looking ahead. We're going to be doing a partnership with Metro Lab, which is a consortium of research universities focused on smart cities around the US and beyond. They're doing their annual summer conference here in Portland, June 26th through the 28th. And we'll be working with them to highlight some local projects and initiatives, including an innovation showcase on June 28th. And then there'll be plenty of other programming on the 26th and 27th as well. A lot of exciting people coming in from around the country, including representatives from federal funding agencies. So think, like the US Department of Transportation, NSF, Economic Development Administration, et cetera. So it'll be a good chance to put our best foot forward as a region and highlight all the great work going on locally. Encourage you all to take a look. Registration will be up, I think, in the coming weeks in March. And if folks want to get involved in some other capacity, again, feel free to reach out. We've got a couple other Smart and Connected sessions coming up for Q3 and Q4 as well. So stay tuned on that front. And with that, that's a wrap.
Hey,
Thanks, everyone.
Skip,
Yes.
before you end, I had a request to connect, and I'm madly typing my email address into the chat.
Sure.
We're going to end the meeting, and I'm going to lose Mark's information. Will you connect me to Mark Garrett for me?
Yes,
That
happy
would be
to.
lovely.
And
Anybody who wants to connect with me, please go through Skip, and he will connect you so that when we lose this Zoom meeting, we won't lose that info.
actually, Juliana, if you like, what we can do is we can send out to all the folks who registered just a follow-up email that has contact info. And
Great.
Yeah.
Perfect.
So we'll take care of
Wonderful.
that.
Thank you so much.
Sorry for the anxiety.
That's all right. I'm like typing and I'm trying. Oh, okay. I better stop typing to Mark. And thank you so much, everybody. It was a
Thanks,
pleasure
everyone.
seeing everybody.
Bye.
Thank you.
Thank you.